All right, thank you so much. We're just going to stay with this slide for just a moment. Actually, we can go to the next slide. I wanted just to give just a very brief introduction. You'll have to excuse me, I've got some of my little notes, and I have my little notes here just to keep me on track. Otherwise, I end up going, not just branching off, but ending up in a different forest in a different part of the world. So excuse me if you hear any papers shuffling. That's me with my little notes there to keep me on track. There's I wanted to share about the medical benefits of Qigong, of medical Qigong. It's something that I trained in personally, and that's my own experience with health. I've had a long-term medical condition that I've had since I was 22 that affects the nervous system, and it can affect balance, etc. And I'd learned that medical Qigong or Qigong could be something that could be beneficial. And so a few years ago, I learned the more medical side of it. The medical Qigong, became certified in teaching that. And I wanted to share that journey and what I found with that. And so today we're going to briefly overview the origins of Qigong, learn more about the research, what it's showing us about the medical benefits, and what that might mean for us and for our client populations. And so we'll also do a quick practice as well, hopefully, if we've got time. If we can go to the next slide, that'd be excellent. That'd be excellent. So the origins, I'm in Phoenix right now, so it's very dry here. So excuse me, my glugging some water. So excuse that. So in the last 400 years, we've understood more about the world being a dynamic interrelationship of substances, particles, and bodies. And further advancements through our own refined scientific inquiry, we've understood that instead of substance, there's more of a dynamic interrelationship between energies, the particles, the substances, the energies. So what does that mean? Well, medically speaking, we better understand the dynamic interrelationship between our thoughts, emotions, the body, and the body has its own dynamic interrelationship between its systems. And also the impact of all of those systems working within itself, and also that with external factors such as the impact of our environment, our family, our community, further and beyond. And that's on the Western side, but on the other hand, the ancient Asian cultures have always held that the world we experience through our senses is only a fragment of what actually is. So an individual's the energy field is the essence of their being. And that's the focus is on the essence, and the essence that runs through them and around them. That's been the focus, rather than the more Western focus, which has been more on the physical body and the interrelationships with that. We once thought of as the medicine of Asian cultures as being unsophisticated, and yet now more and more we know the benefits of acupuncture and of Chinese medicine. And I'm having a quick look here, so excuse this. We've given more focus to acupuncture, and we understand more the science behind the acupuncture as manipulating new neurotransmitter biochemistry. And that's been incorporated into our own treatments, especially where we've seen with addiction, I think is where I've seen it the most. And I started doing some counseling in the 80s, way back when, and I saw that we'd started to bring in acupuncture to treat addiction way back in the 80s. So we're looking at, well, what is Qigong? We're going to stay on this slide for a bit. Well, what is Qigong itself? And so with the acupuncture, we think of Chinese medicine, and we think of the ancient Chinese medicine. We think of acupuncture and how the benefits of acupuncture and how we've seen that being really beneficial. That's one aspect, one small aspect of the overall far-reaching different subjects within or modalities within Chinese medicine. But the one that has the greatest implication has been Qigong. And in the US, we've got our associations are creeping up more and more and more. I've got I've got those mentioned in the resource page if you want more information on that. So what is Qigong? It's the root of self-care. It's how physician heal thyself began to operate in China. If we think of Qi, and that's QI, Qi, as being human vitality, the essence, the functional energy of life. The flow, it's the flow that maintains healthy and harmonious function of the body's self-regulating systems, homeostasis, as we call it in the West, and it's beyond the body. It's the life force that connects with or is our emotions, our experience, our mental thought processes. It's the chi, it's the life force that connects us to each other, that connects us to the land, to the aina, connects us to everything. So as we bring it in, then that system of lokahi, so to speak. Well, if that's chi as the life force, then what's gung? And it says that it's gong, right? But it's pronounced gung. So qigong. So gung is the action, if you will. It's to engage in. It's the movement of. It's the flow of. So it's the direction of the chi. So if chi is more the cultivation of that life force, and that is what it is in its beingness, then gung is the action of that. It's the direction of that. So we can say that it's the cultivation and the direction of life force energy. So in more Western scientific terms, I think I'm going to go some more water, is, and if you see me giggling, I have a very compassionate laugh at myself quite often when I pause like that. It's like, oh, that just makes me giggle to myself. So in Western terms, Qigong is the practice of activating, refining, and circulating the human bioelectrical field. And if the bioelectrical field, if this bioelectrical, this energy field supports and maintains the function of organs and tissues and our own mental health, our emotional health, it stands that Qigong may have a profound impact in health overall. And again, I've said about the mental health as well. So it can improve our focus and also our calming down, our self-regulating. So Qigong itself will range, the practice of it ranges from very simplistic, focuses on posture, on slight movement, breath, and more complex auto-regulatory exercises where the practitioner focuses the chi, if you will, where it can alter brainwave frequency, heart rate, and other functions intentionally. Okay, so, and I've got here Qigong's golden rule, ABC. And as a nurse, I'm also read as a nurse. My background's in nursing, and I think of airway, blood, right, airway, breathing, circulation, right. But but in Qigong, it's always be comfortable. Yeah, makes it a bit easier, doesn't it? So if we pop to the next slide, excellent. So in the Western, I've got this a little bit the other way around. So in the Western world, we tend to focus more on the bodily systems, the functionality of the systems. I'm a big believer in functional medicine. I think it's really important how the systems are functioning independently and then also together. I think that's highly important. And then the Chinese focus is more about the cultivation and the flow of qi. And I see how that can just be just such a, how it can just really benefit each other as well, how we can really work in tandem with that. Let's go to the next practice. Yay. So I put here, in Qigong practice, we can take our mind off the expectation or need to. And we can, with qi as being the life force that is within us and also around us, it's that beingness of that, letting go of the need to and the push of that, and the the gung is the flow, allowing that flow to happen, or making, say it too hard, but nudging that flow to happen, as it were. So it's a much more gentle practice, so to speak. Okay, and I think there's also, and I've written this down here, that if the qi is the cultivating of the energy force, and then the gung is the movement, it's the activation. And it can be a very gentle activation, as I said before, some very, very simple exercises to doing some more vigorous exercises, but yet always in a more flowing kind of state. So we want the art of doing Qigong to be more pleasurable, relaxing, and uplifting experience. And we can pop to the next slide. So we're kind of going through this quite quickly, which is really good. I'm not going to list these because you can read it through yourself. And that's everything I've listed there has got research to back it up. And I'm not talking of, say, maybe an expert opinion. I'm talking about randomized controlled trials and blind studies, that kind of thing, that have actually shown us the research here and what has been, where we found some benefits on the medical side of things. And so I'm having a quick look where you've got where you've got at the end of what I've listed, you might see one or two little stars that correlates to, instead of numbering it, I did the little stars that correlates to the on the resource page. So if you wanted to have a look at that and to cross correlate, there's some evidence, some resources that I put down that actually will correlate that. And again, I didn't really want to just read through the slide that I created there. But they're just examples of the benefits that have been shown through studies. And yeah, one of the main places where you can find resources is in the National Qigong Association USA, and I've put that has links to some really good resources, including the latest research. And I've put a link to the National Qigong Association on the semi to last page for everyone. One thing that I've been really quite astounded by, and that was just how many positive benefits can be done by doing so little, like just some very gentle movement. And I keep thinking persistent movement by doing it, how much benefits can be done. And I put that down as that's on the and excuse me there, as I'm looking for the one that has potential to reduce inflammatory markers, and that's comparable to physical exercise. And that's what I mean by, and that's the second to last there, that I put the physiological processes and potential benefits. That was something that really I was blown away by, just when physical, quite rigorous physical exercise was compared to some gentle Qigong, and what could actually be happening within the body and within the full systems with that. It just kind of blew me away with the benefits that can be gained from just such gentle movement. But if we do this just gently, right? If I'm doing this, that's one of the exercises, and I'm just doing it very gently there. I'm moving my arms, my hands against 14.7 pounds of gravity. Hang on a minute, I'm doing a bit of weight training right there. And we forget about that because we're moving against gravity all the time, right? And I just think that is absolutely outstanding in itself. But it was just that one, as I'm looking through research and doing more and more research about Qigong, it was that one study that just really blew my socks off. So I wanted to share that, and I get quite passionate about the work that I do and what I get into. If we go to the next slide as well, in the next one is just very simple. I know that we do know other Herbert Benson did the Dr. Herbert Benson is quite famous for his relaxation response using deep breathing, diaphragmatic breathing, to reduce the stress response. And I wanted just to show that we get the same results by doing Qigong. And I know that it's not Qigong's the be all and end all, it's one modality that we can use. However, I did want to just put it up there that it can have some of the, exactly the same sort of like markers, but I love how it, can have impact on the with the stress response, how we can use Qigong to down regulate, but not just down regulate on one system, how it works in a to address when we're elevated, Qigong can address a variety of systems just in one go there with just some very simple, again, just some very simple techniques. That's how I get, again, just very excited about Qigong. And let's go to the next slide. So we're zooming through. With the mental health, on the mental health side, this is where I've really seen it gives a little bit there the suggestions for incorporating Qigong with various populations in various contexts. And I've used I've used Qigong to down-regulate clients when they've been in a high panic state or working with professionals in high levels of stress. I was out in the field today with trauma survivors. I quite often will go out in the field when there's been houses or areas where there's been an uncovering of people who've been sex trafficked, and I live in Greater Phoenix right now, so we've got a lot of stuff going on. So I'll sometimes go down and act as a mental health resource for survivors. And I've utilized Qigong in those moments because it can really help to de-escalate and to down regulate some of the high emotions that are going on. And I've used it with clients individually when they've been in panic, but also with addiction and with high stress. And I think it's also really a lovely thing to do, to be able to teach the clients that I see in private practice, as a tool that they can utilize themselves. They might learn one Qigong method or movement or lack of movement, but one Qigong practice, and they might learn that, and that can help them to de-stress, to down-regulate their emotions, to help with emotion regulation, right? To help with sleep, to help to get more oxygen, to get more focus and more energized, and it can help to distract, to reset the system. And I just think, again, it's just that the populations that we can utilize Qigong with is vast, and I just think it can be such a useful tool to incorporate into our own practices. And so we can go to the next slide. And we're moving through really quickly, which is lovely. So yeah, the credibility check. These are the list of institutions that have either researched and been shown research, and they've been putting out the research, or incorporated Qigong into their services. And the slide also acts as another resource for those interested in looking further into the applications of doing of the Qigong too. Let's go to the next slide. Is good. And that's, again, repeating what I've said in it for a couple of slides ago there, but have a look down that list. And those are all applications where Qigong has been really quite useful and has been written about and studied. And I think that's, again, just shows the implications of utilizing such a modality. And I love the idea too with the The geriatric health, I think, is really important. It's often an area where we often will not place as much focus on. I think it's still a very important part of the care that we deliver, and also community building, where we can if we're utilizing, or if we're not utilizing, if we are doing some qigong, I'll go out into whatever area that I'm in, and I'll start doing some qigong, and people come and join in. If I'm doing it on a regular basis, you get more and more people coming in, and it really starts to build up more of a community. And so again, it can be a community building exercise as well. So again, just have a read through that slide. I'm not going to read it through because you can all read it. And let's go to the next slide. I'll let you read that. And that's the dude that I did my training with. And he has and I put a link to his website, his institute, which is the Institute of Integral Qigong and Tai Chi. I put that in the resource page, and go to the next slide. And that's another one of his quotes. And he wrote a couple of books that have been really beneficial for me to read, but I think can be really excellent reads for other people who are interested. And I put those down in the resource page as well. And the next slide is let's practice. And I just want to say that the last two slides, we don't need to move those two slides, but are the resources page. And then there's a slide, the last slide is on how to contact me, but we don't need to see those particularly. I'm just wondering because we are now half past the hour, so I tried to get it into quite a short presentation so that we would have some time to practice. So Echo hosts, what do you think? Or do we have any questions? Or
we don't have any questions. I knew I would feel better during and after today's talk, so I already am, so I like that. I was wondering, so.
And Kelly, can I ask you, what is it when you said that you already feel
I knew I would feel better just hearing you talk and talking about Qigong. So, and I am just feel calmer. So Tai Chi is the movements, right? The movement. Oh, okay.
So it seems to go, and that so Qi is the life force essence. Gung, and it's spelt gong, but it's pronounced gung. Qi gung is the movement of the life force. So by doing various exercises, and even that can be sitting with an intention or breathing, that can move the qi. So I can be intentionally moving the qi or allowing the qi to flow by doing some deep breathing, or just by sitting and meditating and focusing my mind. Therefore, I'm moving the qi. So gung is the movement of the qi, is giving it a direction. Whereas, so in qigong is the starting point, if you will, and then Tai Chi is another, I don't want to say another level, but Tai Chi is another way of moving the Qi for its own practice. It has a lot of the same benefits, the Tai Chi. It is a lot more movement than the Qigong, but Qigong is the precursor to Tai Chi. So did you ever see, and I'm going to stand up and do it, I always call myself Nurse Ratchet when I do a demonstration like this, so excuse me, getting into my Nurse Ratchet mode, right? Ever see, when you see on the mountain tops of the martial art films, anything that's martial art, you tend to see this, there's somebody on the mountain top doing this kind of exercise. Mm-hmm. What I'm doing is I'm doing Qigong right there. And it's lovely to see. I mean, I could do this like all day. I could really just get into it and just do it. And I'm cultivating the chi, and I'm moving it, not just in my arms, but it's going through the whole of my body. It's in my focus. I'm bringing my system is calming down. And yet all I'm doing is moving my arms in a very particular manner. Isn't that lovely? It's called Clouds Pass By. Isn't that just lovely? But that's what we see at the beginning of any like martial art. So the Tai Chi is another layer. That Qigong is the precursor of Tai Chi. Does that make sense?
Yes, because I always thought I thought of it as, well, Tai Chi is that stuff they do in the park. And so how do you do Qigong, or how does Qigong happen in an office? Or is it a piece of the Chinese medical system?
It's Qigong is it really is the precursor. And so what you might find that you're seeing in a park, you might actually see people doing Qigong. And it might be a little bit more dynamic to see people doing more Tai Chi, could be a little bit more dynamic. And I was kind of, there's a movement, I did Tai Chi a lot of years ago, and I'm trying to think, there's a wonderful movement in Tai Chi called Repulse Monkey. And I just think, oh, that always made me laugh. It's like, oh, your monkey's repulsive. So it just made me really laugh with that. But so you might see that what you're seeing in the parks, especially with the older populations who tend to do it very often in the parks, that could well be Qigong. Now they might be doing Qigong and then also adding then some Tai Chi as well. So, and that's Roger Yankee, who's the person that I studied with. His website and his institute is the Integral and I just said it, didn't I? The Institute of Integral Qigong and Tai Chi, because it's so closely related. Does that make sense, though, that Qigong's the precursor? Qigong is a little bit of extra movements, if I put it that way.
And is it safe to say that it's part of the more comprehensive Chinese medical system?
Qigong's the absolute precursor of it, yes.
Okay.
Because
yeah, I would say Western medicine needs a movement part to it as well. You know, Western medicine seems a bit stagnant. You go to the office, you get something, you take a pill. I mean, there's physical therapy and stuff, but I guess, yeah.
I'd love to do, because I do, I mean, I have a case study too, but I try to keep it sort of short because with some resources on there, because this is such a, and if we think of, and again, acupuncture is one aspect of Chinese medicine, but the Qigong is I was going to say the foundation. It's the precursor, but it's the foundation, because Qi is the cultivation of energy, and Gong is the direction of the energy. So we're utilizing it in acupuncture, is being manipulated. So does that make sense? It's the far-reaching underlying again,
Yeah.
the precursor.
And it seems like the addressing the chi is embraced by a lot of things like tapping therapy and the acupuncture, as you said.
If chi's the life force, is the essence that runs through everything, runs through me and around me, runs through you and everyone else and through them, and it also connects us. And we know from our our nervous system, we know about we pick up each other's energy, which is transpersonal neurobiology. Like we're picking up on each other's feeling systems, the biome, right? And so, and then we think about, and I love it, we in Hawaii's with the aina. So the aina has the chi, and we feel that, and we are part of that, as well as Lokahi, we're part of all and everything. And so if we think about the chi, then if things are flowing harmoniously, it's the same with the EFT, right? If things are flowing harmoniously, then there's a balance then we are dis-ease free. There's an ease. If things are flowing harmoniously, they're flowing with ease. When they're
Ease.
not flowing with ease, that means there is a dis-ease somewhere. And so that's where that we're not flowing, we're not in harmony somewhere in the system, wherever the system is, wherever that might, I don't want to call it a blockage, but where that dis-ease, that imbalance, and that's not to start going into down a new age track of, well, it must be something that you're doing out to make yourself out of balance. Well, sometimes, we have we get given cards in life, and sometimes we get given a bit of a funky hand. How are we going to play that? So sometimes we're born with, or we develop with dis-ease. Yes, dis-ease, not decrease, but dis-ease.
Disease,
Yeah.
dis-ease.
Dis-ease. So rather than if it's not flowing, then if it's flowing, that's ease. There's an ease with the flow. If it's not flowing, then that's a dis or not ease of the flow. And I just want to say that that's not to say, well, we've all got the ability to get over every single thing. I just think I've got to just bring that in, because I know there's a whole new agey system of, well, you've manifested this yourself, whatever, and there's a whole blame culture with that. And I want to move away from that and say, sometimes in life we get given these cards, or we're born with these cards, which might mean that there's a part of us that has a lack of ease in a certain area. So how are we going to live our life with that piece of us that's not in balance? And so how are we going to, sometimes we can get it in balance, we can get the flow there, and sometimes we have to have the flow around it and incorporate it and love it and bring it in as much as we can. Did that make sense? Hopefully that made sense. I just think that there's so much blame and shame for a lot of folk sometimes now if they're dealing with things. So hopefully that made sense to folk. So do we do a little bit of Qigong? Do people feel they want to?
Do it.
Let's do it. So now I'm going to stand up and do it. We're going to do very, and I might have done this before, but I've got my bike shorts on, so we're good. We're not in the stupid heat right now, so that's good. And you can stay seated, you can stand. For patients, they can be doing it lying down in bed. We can be doing it lying down in bed. If you're seated, just make sure that you're not going to be hitting a table. So what we're going to do is, if you're standing or seated, have your legs so that they're just over hip width apart. So you've got a good stable base. And we want to make sure the shoulders we're not hunching our shoulders. And remember that people can be doing this lying down as well. So from their wheelchairs, or we can have it seated. What we're going to do is you're going to have a little bit of space in your armpits, and you're going to have your palms facing forward, and just going to very slowly and gently start raising our palms toward the ceiling. And we're going to slow it down. We're going to slow it down. What about your breathing? Just breathe. Just make sure you're breathing. You don't have to marry the breath to the movement. We can do that later if you want to do that. You don't have to do that. And you're going to move the hands as far as you want to go with them. And then when you've moved your hands as far as you want to go, let's have the palms then facing the floor. And we're going to slow it down, slow it down, slow it down. We're focusing on the movement, putting our full focus on the movement. We're slowing it down, slow the movement down, slowing it down, slowing it down, going slower than we thought we'd probably want to go. Let's do it again. So moving, palms facing up toward the ceiling. And again, we're moving against 14.7 pounds of gravity. As we're doing this, the more that we do it, We're increasing blood flow. That's increasing oxygen flow. We're starting to put the brain into alpha state of relaxation. So we're affecting the nervous system. We're also increasing lymphatic flow just by doing this movement. How about that? Quite incredible, isn't it? Let's do it one more time. And I just think about the people that might be lying in bed, the people that are in wheelchairs, the people that have had amputations, that we can still be doing this. It's totally fine, and we can be benefiting, not just the arms and not just the hands, but the whole system can be benefiting from that. And I want to try one more thing just to show this. If you're standing and you feel comfortable to close your eyes, great. If not, then let your eyes just go soft. And I want you just to imagine the movement that we've just done. So we're not going to actually do the movement, but imagine doing the movement. If you can close your eyes, great. If not, have your eyes soft so you don't fall over. Remember, always be comfortable and always be safe. Imagine that movement that you've just done. Imagine raising hands and slow it down, slow it down, slow it down, slow it down. And then bring your hands back down. And just imagining yourself doing that movement and focusing on that movement, on imagining doing it. And let's do one more movement. Well, let's bring our hands up again. But this time we're going to have our fingers dripping down as if I've just put them in paint or water. And I'm bringing them up, and then I'm going to just stretch back a little bit. Again, just be comfortable as far as you want to go. And then as you stretch back, as you start to come forward, let's put those hands into fists. Put the fists together. So you bring the fists together, and then as you bring in those palms or the fists down, squeeze everything in your body. Squeeze your glutes, your tummy, your face, your arms, your legs, your thigh, everything. Squeeze everything you can. Squeeze, 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 and relax. Let's give it a shake out. Let's have a good shake, shaking it out. And then let's just giving everything a good shake, right? And then what I'm going to do is I'm going to put my right palm into a fist, and then my left palm stays open. I'm putting the fist of my strength fits nicely into the palm of my compassion. And that's it. That's what we're going to do for today for practice. So thoughts and feelings but any thoughts, comments on what we've just done? Just on it for a few minutes there, but any thoughts or comments, or I'm curious.
I felt more relaxed. Teresa says, is it possible to do Qigong wrong and cause more disease? Is that part of the blame culture?
I think with the blame culture, I think it's what I see as the blame culture is the idea of whatever we've got, you've manifested it, you're at fault for that. So I think that's what I see as more of a blame shame kind of culture. With Qigong, there hasn't been any research that I've seen that is contraindicating. And I think with the main focus of Qigong is ABC, always be comfortable. And there's no wrong way of doing it. So I gave a little shake at the end. Then, hey, it's fine. Whatever little shake is good. That's fine. That's all part of it. And so there's not a wrong way of doing Qigong. And I'm curious to what folk felt when I asked them to imagine doing the movement up and down.
Well, Madeline commented that slowing down creates such a different experience of movement. And Nitsa could feel the shift in energy.
And that's just in such a small. And what I loved about that, and why I asked us to spend a moment just imagining the movement. what if somebody is locked in, and we'll talk about it, the medical system of being locked in, if they're quadriplegic, and we know because of chi is flowing through everything and it affects everything else. It's a whole system. It's part of a system and it's all connected in together. Then the benefits that imagining doing the movement, if we're not actually doing the movement, of imagining doing some small movement, can have a far-reaching impact on the physical system. And I think that's something that we need to explore a little bit more in our Western focus on things. That's just my thoughts. And again, with the lying down and doing that, and the research with that, that's the flow, right? You can be lying down and doing it. You can be sick, impaired, geriatric. Again, you can be, in various stages after surgery or something like that. You're not going to pull the stitches, though. I mean, that's it. Always be comfortable and always be safe. So, but the far-reaching, just doing that movement of that, we've affected our autonomic nervous system. We've affected the blood flow. We've affected the lymphatic flow just by doing that movement. I think that's quite outstanding. And that's just my thoughts with Qigong. I love it. So
Sharon says, I feel like it also helps my posture as I feel more body awareness.
and that's with the three treasures, which is how you cultivate Qigong, is the three treasures is the body, breath, and mind. And so that's how we're cultivating it. And with the mind, we can be focusing on it. We can be meditating on it. With the breath, we can be doing the deep breathing. We can just be breathing normally and focusing on that. And with the body, that can be the posture. Doesn't need to be the movement, but on the cultivating, it can be the posture that we're having. So it is a very mindful practice in that sense. And then we're cultivating chi by our posture, by the focus of our mind. And that can include the non-focus of the mind, and the breath. And then how we direct the chi is by either through the posture, and posturing, it can be through movements, it's the body, it can be through the breath, and through, again, the mind, the focus, and the focus can be of not focusing, and the intention. And there's also massage. That's another thing too with Qigong. It's about giving yourself a bit of a massage too. And that can be lovely as well, because how much can we do that? And I think we forget that if you get the heels of your hands, and if you give yourself a bit of a face massage and give yourself a good squeeze around the neck and the shoulders, and you do that either side, and you pull down on the earlobes a bit, and you squeeze around the ears, and you push against the occiput a little bit. And then if you get the heels of the hand and you go on the shoulders a bit, but of course you're going to miss the breasts or the pecs, and you go underneath your arms. Now you can be going down on your rib cage. Oh, and you can press as hard as you want to, as feels comfortable. And then if you go down on your glutes, and you can even squeeze your glutes, etc., and then down to the back of your thighs, down your legs, around your feet if you want to, and then up through the inside of your legs and the front of your legs, and then back up again, have a little squeeze around the belly. And that's a little massage right there. And just doing those few moments of the self-massage can be, and that's again for the generating of the chi, directing the chi. That in itself can be such a self-loving exercise, but can be such a de-stress and such a nice I guess a nice part of our self-care. But how good do we feel if we just did that little bit of massage, self-massage? And again, that heels of the hand and pressing down and on the rib cage and down through the back of the glutes and down the legs and up the legs and on the belly. Can just feel like, I'm reset, I'm re-energized. And that's I don't need my cup of coffee. I can do quick massage. Nothing against coffee. I like coffee, but I'm just saying, it can be a if you're having that a bit of an afternoon lull, so to speak. Hopefully that makes a bit of sense. So
Yes. Um, yes, very nice. And powerful energy, Crystal says. Evelyn Joy in Palau says that although the screen kept freezing, it's very interesting and useful to their clients. So that's exciting. I was thinking, I was distracted while I was sitting here, but just by doing this, even while sitting, I feel more focused and alert. Yeah.
I've had people come to me just even in a Zoom session, if I'm doing a Zoom session with them, and they're in a state of panic. And I'll say, well, let's just do this. And I'll get up and I'll say, can you do this? And I'll get them doing that. And within seconds, their whole demeanor changes. And we've gotten rid of the panic within seconds. And I've not had to do any talk therapy. We've not had to speak about anything. I say, oh, let's just try this. And I think that can be really quite powerful in itself. And how lovely if we, I teach a couple of different exercises to folk and they take it away with them. And now they can practice themselves to self-deregulate, to down-regulate. As part of the emotion regulation, as part of to de-stress, to down regulate if they're feeling triggered, etc. And how we never empower anyone. We can give certain tools which might help folk to empower themselves, right? And so that's the beautiful thing when somebody's felt maybe in trauma situations when they felt powerless or because of anxiety or panic situations, etc., they tend to have felt more powerless or hopeless. Then by using certain tools, I'm not saying Qigong is the be all and end all, but I've certainly seen some really positive aspects or results of it that somebody can take something so simple away with them and maybe try a couple of things and now they're able to do something for themselves that can have a really powerful effect. So I like that. I've just read a couple of the things. Yeah. The brought awareness of the blood flowing through my body. We don't tend to pause, do we, very often in this busy, busy world?
You breathe in on the way up and then breathe out.
Doesn't matter. Just
Doesn't
keep
matter.
breathing. Don't hold your breath. It's as if Qigong's something that you bring into your daily practice, then you might find that you're marrying the breath with the movement. But to be honest, it really, to begin with, it doesn't matter. Just breathe.
Because my yoga instructor is a little militant about the in breath and the out breath. And I'm like, I don't know.
Yeah, and yoga is about yoking yoga. Well, I'm still did my yoga teacher training many, many years ago. Yoga is about the yoking of the breath and the movement together. And that's the yoga part of it. With Qigong, it's like you're breathing. That's good.
Like that.
That's the preferred state.
Yes.
You're either breathing or you're not, right? So it's the breathing. The main thing is as you're doing the movement, just keep breathing. And as you're doing it, you might find that your breath starts to go, because it might be a different breath in or out, depending on what you're feeling at that time or where the chi wants to flow or needs to flow in that moment, so it's so individualized, but yeah, you don't have to, there's no right or wrong with it. There's certainly no militance with it.
I like how it's free. I like also how when I learned how to meditate, it was that you don't have to worry about what comes into your head. It's okay. It's like it's okay to relax. It's okay to think things. It's okay to breathe whenever you want. So that's nice.
What I've found and the feedback that I've gotten when I've worked with folk and we've done that one movement. We've done other movements as well, but say we'll do that one movement. We might have done that for say 5 or 10 minutes even with folk. And I'll invariably get the feedback of my mind's quiet. And that in itself, when you've got somebody with very high anxiety or they've been very highly triggered and their mind is so full, it's PTSD, it's panic, they've got all that stuff in their head. And by doing something so simple, such a simple movement, and the feedback that I'll get is, my mind just stopped. I don't know when it stopped, but it's, I'm much
Ah,
more quiet now. So, and how wonderful that can be for the when we're craving
mm,
something too with addiction.
oh,
And we're kind of, I did have a case study, but I've talked over
yes. Well, this was lovely.
five.
Thank you so much.